Hi, I'm Nomie. I'm going to be talking to you today about some of the pre-op procedures that you need to be doing if you're having surgery with us. You need blood work and you need urine. Blood work is CMP, CBC, PT, PTT, A1C, and HIV. You will also need to do a urine analysis with the culture. If you are anemic, and you know that you are anemic, we suggest that you please go do a CBC, which contains your hemoglobin, at least as far out as you can, so that we have time to correct your anemia. Hemoglobin is a big thing here. Therefore, we want to try to build you up to as high as we can go. So we want you to be at the lowest really of a 12. Sometimes dependent on if your A1C is high and you're diabetic, you will need an endocrinology clearance. Anything that you have going on, please refer and ask us, who should I see, or ask your primary. They will also be able to guide you in the right direction. If you have had anything in the past, we need that addressed in your clearance, that you are good to proceed and no longer is suffering from whatever it may have been, or it has been resolved. If you are on medications, Suni will send out a list to you asking you on what kind of medications you're on. She will let you know what to stop and what's okay to continue. Please disclose any ailments that you may have, abortions or Plan B pills. If you've had an abortion 6 weeks before your surgery, we want to know about that. Why? Because of hormone distribution again, and it could cause clotting if we do it any sooner. Now, if you have an abortion, we need a letter from that abortion clinic that it was a successful termination. We also need a negative blood test. And yes, you have to wait a minimum of 6 weeks before you can have any sort of surgery again here. Birth control pills, they have to be stopped 2 weeks prior to surgery. If you have an IUD and it disperses hormones, that needs to be taken out as well 2 weeks prior to surgery, or longer, however you prefer. And if you have an implant in your arm that releases hormone, that will also need to be taken out. We want to know your height and your weight. We don't want to find out come a week before surgery or 2 weeks before surgery that your BMI is too high to have surgery and then we need to cancel you. We work with you, we will help you, encourage you. As for supplements, we want you to take iron and vitamin C. Iron is 325 milligrams, and you need to take that with vitamin C just because vitamin C helps absorption of iron. So 500 milligrams of vitamin C in the morning and 500 at night kind of breaks it up because the body can only absorb so much. So therefore we break that 1,000 milligrams up into 2 servings. I do want to emphasize that not all supplements are good supplements. The best quality iron supplements you can find at Whole Foods or any vitamin store. Tylenol is the only medication that you can take 2 weeks before and 2 weeks after for pain, headaches, whatever it may be. That's over the counter. Advil, ibuprofen, Motrin, all of those are blood thinners, and we do not want you to be taking that before or right after surgery, as that will cause bleeding. When you leave here, you will receive a lot of written information from us as to what you should do. Don't worry about so much before you get here what's going to happen when you get home. The only thing that we ask you to do prior to arriving is schedule your massage appointment, or at least find a good therapist in your area so you don't have to worry about when you get home. Once we have received your labs, your clearance, your EKG from your doctor's office, we go through it, we clear you. And once that process is done, I will send you an email letting you know that you've been cleared and you're good to go for surgery. We're looking forward to seeing everyone soon.